seminar. We have a bit of a glitch on the PowerPoint, so you all have a handout, I hope, with all the slides on it. And so Dr. Riley's going to work without the modern technology, but I think it'll be just fine. A couple reminders. One, if you have cell phones or pagers or things, please put them on silent. If you need to make a phone call or take one, please go out in the hallway. And the restrooms are out in the hall to the left. We are recommending that everybody get flu shots, and hopefully most of you have. We don't have any more vaccine. We've used all our allotment. There is no shortage in terms of what's available in the area. It's just our supply is gone. So anybody asking or needing one, there are pharmacies that have an abundant supply. The seminar will be on holiday until February, so this is our last seminar of 2011. Over the holidays, we tend to give the seminar a break. The door prize for tonight is a book. This is no reflection on Dr. Riley, but it's called The Knife Man. And this is about a famous 19th century physician who did all kinds of interesting things, experimenting on animals and somewhat on humans, but contributed a lot to the knowledge base that we have now. It's also, I think, apropos for being close to Halloween. So we'll be giving that away. And let me introduce Dr. Riley. Dr. Anthony Riley went to medical school at the University of Pennsylvania and completed his residency training in medicine and primary care at University of Maryland. He has been a faculty member at Maryland and here at GBMC. And his specialty is geriatric medicine, and he works in the field of hospice care and palliative medicine as well. I think I will leave it at that. And Dr. Riley, proceed here.
Well, thanks to Dr. Green for inviting me to speak with you this evening. I apologize for the technical glitch. As a geriatrician and hospice palliative medicine physician, I speak often on the topic about advanced directives. I also was the chairman of the GBMC Ethics Committee for almost 8 years, and I had the opportunity to provide guidance to professionals and to patients and families who were facing difficult decisions about treatments, and particularly guidance for patients who were unable to speak for themselves. Over the next 30 or 40 minutes, I'd like to share some information about advanced directives and how they're implemented in Maryland, and to give you some insights into how our practice approaches this in caring for elderly and patients who may face life-limiting illnesses. So the first slide there. In Maryland, there are 2 documents that have to be completed to ensure that your wishes will be respected in the event that you're unable to communicate them yourselves. They're listed there. One is the Combined Living Will and Healthcare Power of Attorney, and then the Do Not Resuscitate Order form. First, let's talk about advanced directives. It's defined as a legal document that enables an individual to convey your decisions about end of life ahead of time. That's the key thing. You can do this in advance. These instructions are typically on 1 or more legal documents and encompass usually a living will and the healthcare agent power of attorney, also called a healthcare agent. The advanced directives help ensure that a patient's treatment preferences are used to guide the medical decision making. They only go into effect when the patient's unable or does not wish to speak for him or herself. These directives may be necessary either on a temporary basis if you're unable to speak for yourself, or on a permanent basis if there's a permanent incapacity. In Maryland, the living will, which exists in other states as well, and the appointment of a healthcare agent are usually combined, and we talk about them together as the advanced directive. The Maryland form allows you to appoint a healthcare agent, name 2 backup agents. You can define the powers of that agent. You can restrict them or give them all kinds of latitude in making decisions. And you can specify what the goals and other values are. So you have a wide opportunity, a big opportunity to express your wishes through these documents. In Maryland, if you go to the Attorney General's site, they have a very good website, so I would advise you to use that. There's also a separate optional form that's included in this section, but typically many people don't do it. You're not required to do it. And it's what your wishes are after death. These would be organ donation, things like that. So it's intended to be a help to those that will be standing in for you if you're unable to make decisions. The next slide. Patients of any age who are likely to have a serious encounter with the doctor and with the healthcare system can benefit from having advanced directives. Patients may become ill, even from treatable conditions, should have an advanced directive in place for use during hospitalization. People ask that question, why do I need one? It's particularly important for older patients, but even younger patients can benefit from having one. For older patients, the ones that I care for, who are admitted to the hospital, the prevalence or the incidence of delirium is about 50%. So 50% of elderly patients, for me that's over age 80, 85 and above, 50% of these patients experience delirium in the course of their hospitalization. They're not in a position as a result of that delirium to make decisions for themselves. So this is not an unusual occurrence. The advanced directive then becomes a vehicle by which those that are making decisions for you are given guidance. You give them guidance through this directive. Many patients, when I talk about that 50%, are surprised by that. They haven't thought that that incapacity can occur so commonly. Obviously, patients who have a terminal illness clearly would benefit from having these documents in place because the likelihood is high that they'll soon be unable to speak for themselves. These directives, again, only apply if you're unable or incapable of speaking for yourself. So as long as you're able, those directives sit aside and should not be used unless you wish that. There is an option on these directives for patients to delegate decision-making, even though you might be capable of doing so, you may not wish to do so. So while many family and patients and even health professionals may fear having these kind of conversations, in survey after survey of patients, only about 5% of patients say that they would find these discussions about advanced directives too difficult to have. So although we often are worried about it as the doc or as family members, only about 5% would say they're too hard to have. They're not easy to have, but they're too hard, not really too hard for have, and most patients may welcome the opportunity to have these conversations. So why is it important? And this is the next slide. Why is it important to focus on advanced directives? Well, due to advances in technology, there are many, many choices out there. Lots of possible medical interventions. And these treatment choices have complex pros and cons that need to be weighed, particularly for patients who are frail or who have multiple complex medical chronic conditions. They involve different burdens and have different likelihoods and chances of success. So advanced directives ensure that patients receive individualized care that reflects their unique values and goals. Next slide.
What page are you on?
This would be page or slide 6. Sorry. I'll remember to try to do that because I realized they're bunched in there. So advanced directives are seen as a way for the patient to exercise their rights to make decisions about their own bodies and what happens to them. It's a way to exercise their right to autonomy. Autonomy is the big ethical underpinning for advanced directives. And these rights were not always present. And it was in 1990 that a federal legislation called the Patient Self-Determination Act sort of codified this as a principle that had both ethical and legal standing.